Human respiratory syncytial virus is a common respiratory virus that usually causes mild cold-like symptoms. Most people recover in a week or two, but RSV can be serious, especially for infants and older adults. RSV is the most common causes of bronchiolitis and pneumonia in the children younger than 1 year of age. Characteristics of human respiratory syncytial virus. The long filamentous shape of the particles likely also confers fragility. The RSV envelope contains three viral transmembrane surface: glycoprotein, the large glycoprotein G, the fusion protein F, and the small hydrophobic SH protein. Classifications. Human RSV exists as two indigenic subgroups. Subgroup B were determined by dideoxynucleotide sequencing of polycistronic cDNAs and mRNAs. Subgroup A, strain A2, showed that the intergenic sequences were not only conserved within or between the strains. RSV pathogenesis is complex and variable. Diseases can range from mild to lethal and can encompass a wide range of acute upper and lower respiratory tract diseases manifestation, from mild rhinitis at one extreme to bronchiolitis and pneumonia at the other. The heterogeneity of RSV diseases also can include an association between severe diseases in infancy and subsequent airway hyperreactivity during childhood and perhaps beyond. Giant cell pneumonia in immunocompromised patients, an infection of the institutionalized elderly that result in exacerbation of underlying conditions and excess mortality. Prevention. No vaccine exists for respiratory syncytial virus, but these lifestyle habits can help prevent the spread of this infection. First is wash your hands frequently. Teach your child the importance of hand washing. Second, avoid exposure. Cover your mouth and nose when you cough or sneeze. Limit your baby's contact with people who have fevers or colds. Third, keep things clean. Make sure your kitchen and bathroom, countertops, doorknobs, and handles are clean. Discard used tissues right away. Fourth, don't share drinking glasses with others. Use your own glass or disposable cups when you or someone else is sick. Fifth, don't smoke. Babies who are exposed to tobacco smoke have a higher risk of getting RSV and potentially more severe symptoms. If you do smoke, never do so inside the house or car. Medical impacts of the viruses. Signs and symptoms of respiratory syncytial virus infection most commonly appear about 4 to 6 days after exposure to the virus. In adults and older children, RSV usually causes mild cold-like signs and symptoms. They may include: first, congestion or runny nose; second, dry cough; low-grade fever; fourth, sore throat; fifth, sneezing; sixth, headache. RSV infection can spread to the lower respiratory tract, causing pneumonia or bronchiolitis. Inflammation of the small airway passages entering the lungs. Signs and symptoms may include: first is fever; second, severe cough; third, wheezing; fourth, rapid breathing or difficulty breathing; fifth, bluish color of the skin due to lack of oxygen. Infants are most severely affected by RSV. Signs and symptoms of severe RSV infection in infants include: first, short, shallow, and rapid breathing; second, struggling to breathe, chest muscles and skin fall inward with each breath; third, cough; fourth, poor feeding; fifth, unusual tiredness; sixth, irritability. Banana streak OL virus is a name given to various plant viruses in the genus Vadnavirus. Banana streak was first identified in 1958 in Cote world and is now in many countries in the tropics. The primary symptoms of diseases are chlorotic streaks on the banana leaves and splitting of their pseudostem. Characteristics and classification. A characteristic of infection is the periodicity of symptoms expression in leaves. Plants may not show streak symptoms in all leaves and for several months at a time. Emerging leaves may be symptomless or show only slight symptoms. Symptom expression seems to be associated with the change of seasons and fluctuating temperatures may play a role. The intensity of symptoms has been associated with the concentration of virus in the tissue. The higher the virus concentration, the more severe the symptoms. Pathogenesis. Banana streak virus is a VADNA virus containing a circular dsDNA genome of 7.4 kilobyte that causes a viral leaf streak diseases of banana on bananas. Typical symptoms of BSV include broken or continuous chlorotic streaks or spindle-shaped patterns that are first chlorotic, become increasingly dark in the color, and subsequently result in black streaking. Prevention and control. Due to variable regulations around registration of pesticides, your national list of registered pesticides or relevant authority should be consulted to determine which products are legally allowed for use in your country. When considering chemical control, pesticides should always be used in a lawful manner consistent with the product's label. Impacts of BSV. The damage caused to banana production varies considerably between varieties depending on their response to the various strains that exist. There is also the fact that symptoms disappear and reappear during the growth cycle. For many varieties, yield loss is related to the intensity of infection at flowering and fruitfulling.